Hi, my name's Lucy. I'm a student nurse, currently in my third year studying mental health nursing, and I'm here today to talk to you about emotional resilience. So I guess the first question people would ask is, what is emotional resilience? And there's no one factor. It's a combination of curiosity, communication, control, change, acceptance, clarity of focus, confidence and creativity that all come together to form what we know as resilience. So I guess firstly, if we look at a definition of resilience, which is the capacity to recover quickly from difficulties or toughness. And the Oxford Dictionary cites it as the ability to recover from perceived adverse or changing situations through a dynamic process of adaptation influenced by personal characteristics, family and social resources, manifested by positive coping, control and integration. So I guess that sounds like quite a large definition, but ultimately it's not just to survive, it's to be able to thrive. So within resilience, there are 6 domains. Firstly, we've got collaboration. So that's looking at areas such as support networks, clinical supervision. If you're a student, support you get at university from lecturers, how to manage those perceptions and how to deal with other people's views and actions, and looking at it as well in a social context. Reasoning considers problem solving, your resourcefulness, and also how you anticipate and plan ahead. And I guess if you look at vision, we're looking at purpose, goals and congruence. Composure, again, looking at things like regulating your emotions, interpretation bias, that feeling of calm, and also that feeling of being in control. Tenacity, again, that's persistence, a realistic optimism, and the ability to bounce back in the face of adversity. And health forms a really important part of resilience. So considering self-care and our mental well-being, do we sleep enough? Do we get enough exercise? Our nutrition, so are we eating the right foods? Are we drinking the right things? Is our alcohol consumption in line with recommendations? All of those factors together give us the 6 domains of resilience. So why does resilience matter? As a student, experiences are often stressful, and at times applying new concepts and theories in a practical environment can be quite daunting. So considering all the factors that you see within the graph here, so your optimism, your attitude towards life, your emotional awareness, your control of yourself as well is quite important, along with, again, that social support. And as nurses, I think we'll all agree that a sense of humour is quite important at times as well, in addition to that belief in yourself and the ability to problem solve. New roles often necessitate that students can reconsider personal beliefs and values, and that can be quite challenging at times, but also necessary. And also understanding that resilience in nursing students is essential due to high levels of academic stress when compared to students in other health majors, and that's been documented throughout research. Additionally, it specifies additional academic success as an outcome of resilience. So again, an international study of nurses reported 42% of nurses felt that they were feeling burnt out, which I think is something that, especially at the moment, a lot of nurses can relate to, and a lot of students. And I think it's necessary to address that, to develop that resilience. Secondary trauma and compassion fatigue are commonly found amongst those within a helping professional role as well. And it's taking that time for yourself and ensuring that those problems that you face at work, that you have a space to be able to look and address those without the need to take them home with you. Further studies also highlight a number of work-related stresses, both within the roles and within wider organisations. And obviously we face a lot of challenging situations. So those interactions with the people, our patients, our service users, which can evoke quite strong emotional reactions, especially in those complex cases that you come across, which perhaps are less certain and perhaps you're not quite sure what the outcome may be. It's also been noted that many students actually feel unprepared for the realities of practice. So despite in nursing 3 years of undergraduate studies, many students still go into full-time work after qualifying and feel anxious perhaps, leading into their first roles. However, it is also important to note that the majority of helping professionals do find their roles satisfying and report enjoying their jobs. Okay, so if we look at compassion fatigue, which we've kind of touched on just before, and this is the burnout that people report. So that's that 42% from the study that was taken on the previous slide. So it's the chronic condition of perceived demands which outweigh the perceived resources. So it leads to those feelings of becoming overwhelmed and often quite depleted, and can also lead to those feelings of like work-related hopelessness and that you're not doing quite as you should be. So in terms of developing that student resilience, it is an individualised process of development, and it carries on throughout your entire undergraduate studies, but it's also carrying it on into your professional roles as well. So it occurs through the use of personal protective factors. So as you see from the diagram here, there's many aspects to this. So again, physical well-being, problem-solving skills, emotional management, social involvement, your own personal mission, your alignment to the workplace. So do you enjoy where you're working? If you do, obviously that's great. If you don't, then perhaps that's something to consider as well. And your concentration and focus. And your cumulative success leads to an enhanced coping and adaptive abilities and well-being. So how do we promote that resilience? So it's being able to recognise and manage your own feelings. It's almost what they call the bouncing back. So do you recognise when perhaps things are starting to get on top of you, and how do you then address that? Promoting a sense of self-worth, to form those relationships, colleagues, with lecturers, with everybody that you're within your working role, and to be able to solve problems and make informed decisions. And that doesn't necessarily mean that you solve the problem on your own, but it's addressing that you can recognise the problem and then obviously form a resolution. And to have a sense of purpose and goals for your future. And Darwin quite importantly said, it's not the strongest of the species that survive, nor the most intelligent, but the ones most resilient and responsive to change. And I think that's really important, because resilience is something that it's not innate, and it's something that actually we develop as we work through life. Okay, so the benefits of developing emotional resilience, as you can see there, I've got a model of Driscoll's reflective model. There are obviously other models which people do use, but reflection within nursing is obviously quite important, and to have that structured model to aid your reflection can be very, very beneficial. So your emotional resilience can be developed through various targeted interventions, and it helps professionals to adapt to challenging situations. It also promotes your development of adaptive coping strategies and enhances that professional development throughout, as well as improving your own personal well-being. So the benefits, obviously, as you can see, are great. So if we look at clinical supervision and how that's beneficial, As you can see here from the diagram, I mean, it is based around student nurses, but obviously supervision goes throughout nursing as a whole. So the clinical environment is obviously quite important, looking at the professional nurse as a role model and also as a clinical supervisor, and being able to identify a positive clinical learning environment. Nursing education within institutions, obviously your educator is another role model that you have there. Nursing education institutions, clinical support to students as well, and I think that's really important. Supervision is quite passionate about. I do think that for students, supervision is just as vital as it is for our qualified colleagues. And those values and beliefs of the nursing profession. So it's having those positive work ethics, but as a student, it's behaving in an appropriate way and obviously displaying that. And it was identified in 1994, the potential benefits for healthcare students for clinical supervision by the Department of Health. And then in 1995, the English National Board for Nursing, Midwifery and Health Visiting stated that clinical supervision would be a requirement for all further students. And there's a need for emotional resilience to form a mandatory part of that pre-registration training, in my opinion. And that's also backed up by various studies as well. However, changes to NMC standards in education still mean that in 2020 there is no formal requirement for clinical supervision in higher education. And I know some universities do offer clinical supervision within modules, but I'm also aware that others don't. And I do think that as a student, if you can push for that supervision, I think the benefits are very, very good. So about clinical supervision, so it offers us that reflective and also reflexive practice. It helps to reduce stress. So those cases that you find tricky or those moments in practice which you find quite challenging, you can take into that environment, and it's a confidential space to have those discussions. It also improves your clinical skills through that conversation. And again, in addition to those clinical skills, it's developing professional competence and confidence and linking those theoretical concepts with patient care in clinical environments. And I think that actually we have those discussions in clinical supervision. And again, as I say, they are confidential. So those conversations stay within that environment and they're not discussed outside of it. And it enables that supportive relationship between the supervisor and student, enhancing, again, that teaching and learning process. But additionally, in addition to clinical supervision, it's also important to operate self-care. So promoting our own self-care, and that's referring to the actions that we take to recognise, to treat and to manage our own health. So it's about doing the small everyday things for yourself to keep happy and healthy, and they're obviously very individual to everybody. In addition to promoting your own self-care, it's important to promote that self-care to others. And actually self-care is about encouraging others to take care of their own health. And it has a role in the health decisions that people make for themselves and their families to promote that healthy sort of both physically and mentally approach. And again, we come back to some reflection. So don't forget to reflect on those feelings throughout your journey and acknowledge how they make you feel, because obviously by doing that, that's how we learn. So on the left of your screen, you'll see an NHS checklist, which is a going home checklist, which just covers a few brief points about taking a moment to think about today, acknowledging one thing that was difficult during the working day, and then just to let it go. But considering those things that went well, so considering 3 things that went well, so outweighing the positive from the negative. And to check on your colleagues as well. So actually, are they okay? Has their day been okay? How are they? And asking yourself if you're okay, So your senior team are always there to support you, and obviously do access that support. But are you okay today? Has your day been okay? And then to switch your attention to home, to let your working day be left wherever it is that you work, and to just rest and recharge, ready for the next day ahead. So by acknowledging how you're feeling, you're recognising that you're either struggling or feeling overwhelmed, and that's the first step towards managing those difficulties that you may be facing. Reflect on why you're feeling this way. So have you felt like this before? And if you have, what has helped or what hasn't helped in the past when you felt this way? Practice that gratitude as well. So think about the things you're grateful for and learn to acknowledge your strengths rather than focusing on too many things that may have gone wrong. Nursing is a life learning process, and we're all here to support and learn from each other. Also, communicate your feelings. Talk to someone close about how you're feeling is a great way to combat and alleviate work stress and also work-related anxiety. So talking to fellow students or fellow nurses can also be highly beneficial. Likely to have experienced similar emotions and may be able to offer how to overcome. Taking time off. It's really important to have that annual leave and to take that time for yourself. Mental health problems should have an equal parity with physical health. And if you're feeling unwell in any way, taking time off is perfectly okay. And make time for yourself. Although I do appreciate it can be difficult at times, it is vital to make time for your family, for your friends, and for social activities which you enjoy. Invest in those hobbies and those friends outside of your nursing studies. So looking at emotional intelligence, as you can see from the diagram, everything feeds into everything else. So that's self-awareness, the social awareness, the self-management, your relationship management, your self-performance, and the performance of others. And it's important for the personal and professional development of nurses, for developing an effective nurse-patient relationship, and also for improving those nursing abilities that we have. It's also a key component in mental health nursing, and the goal is to be able to achieve that authentic, open and personal communication. So we must have the ability to examine our personal feelings, actions, resilience and reactions as a provider of care. And also, I'm sure many of you are familiar with the Johari window. Obviously, the Johari window is fantastic for both self-awareness and also what you're not aware of. So looking at the 4 areas. So the areas, it helps you to understand your relationship with both yourself and with others. And it uses 4 quadrant areas, which you can see here. So it's the open, the blind, the unknown and the hidden. But within that, you've got the bits that are known to yourself, that aren't known to yourself, and perhaps things that others know about you that perhaps you don't know about yourself, or that you know about yourself and that perhaps others don't know about yourself. So it's quite an interesting concept to sit down, to draw out a Johari window and to actually sit down and complete. A self tool as well will help you understand more about yourself. It enables us to be open to feedback, and I think that's quite important as well. As much as we're learning, we also need to take that feedback on board and be able to process that, and being able to be aware of how others perceive us, so about your actions and how others look at those actions. And it's a great tool for building teamwork and overall team awareness. And in nursing, obviously teamwork is a huge part of what we do, especially at the moment, given the current situation within the pandemic. We work and we operate as a team more now than ever. And obviously knowing things about yourself and also not knowing things about yourself is absolutely fine, but it's being able to discuss those with others around you as well. And I think that concludes where I've come from today. But what I would say is, if you're feeling stressed at any point, to have that conversation, to take it to a private, confidential space, and to look at the tools that we've given throughout the presentation as a way of developing your resilience. It's not innate, it's not something that we're born with, and actually developing that over time is a process, and it's one that we're all continuously doing and learning from. Thank you for your time.